Appreciate the opportunity to be with you this morning. Really just to provide some updates. I know you've been receiving them from us, and we've been trying to keep you informed, but the opportunity this morning to not only share with you, but for those that are watching or will watch this later, just an overall update on where things stand with the Zika virus. Specifically, we will look at transmission, the cases that are in the United States, the response, and then looking at prevention, which is really the big focus of the presentation. Move it forward. There we go. So just to kind of highlight, Zika is a mosquito-borne arbovirus. Arbovirus is basically a group of viruses that are classified that they carry RNA, and they're transmitted through blood-sucking arthropods. So those are your ticks, your mosquitoes, your fleas. And these viruses can cause anything ranging from Zika, yellow fever, dengue fever, commonly associated with those type of diseases. Zika is not new. It was first identified in Uganda back in 1947. What certainly brought it more lately for it to be on the radar has been what's been happening in Brazil and the cases of microcephaly that we'll talk about in just a couple minutes. I think it's important to point out for the public, when you hear Zika, there's often a raise of concern. But for the average person, Zika, the symptoms that you would feel, and if you get sick from the Zika virus, is really as uncomfortable as the flu, a severe flu. But it doesn't even have to be that severe. Some people that get Zika, that carry the Zika, may never have symptoms and may not feel sick from it. In fact, only about 1 in 5 people actually become sick with the Zika virus, even though they're infected. The biggest concern, though, again, and what's raised the awareness globally, has been the birth defects that are associated if a pregnant woman contracts Zika. And certainly not all pregnant women that contract Zika will get symptoms or will pass along birth defects to their children. But that's what's really brought this to the public's eye so much. And specifically what highlighted that was between 2015 and 2016, there were 4,750 cases of microcephaly in Brazil, as compared to back in 2014, there were only 150. So that huge jump in that reported is really what's prompted the World Health Organization and the CDC to say, we need to get more information out there for people and really focus on the prevention. So Zika is primarily spread by the mosquito, and specifically 2 types. It's the Aedes species, either the Aedes aegypti or the Aedes albopictus. These are really the 2 species of mosquitoes that carry this, and this is the primary way it's spread. So either spread from the mosquito biting a sick individual and then carrying that virus to another individual that it bites primarily. It can be spread in other ways, so it has been identified that it certainly can go from a pregnant mother to a baby, and that's what the big issue is with causing these birth defects. It also has been documented to be able to be spread through sexual contact, so from a male partner to his female partner. And even though not in the United States, but it has been discovered otherwhere through blood transfusions. So those really are your ways that Zika can be spread. Back to the mosquitoes, I think it's important to know about the types of mosquitoes. These are primarily your aggressive day-biting mosquitoes. While they can bite at night, they're known more for the properties of being the aggressive daytime biters. I think it's important to point out that not all mosquitoes are the same. The species that are more known around here are the Culex species. And though, as you can see from the map, the map on your far left is indicating the approximate distribution of the Aedes aegypti in the United States. You can see it's located more in the most southern part of the United States. The Aedes albopictus, which also does carry it, it does creep up higher and is more widespread. But we're not noting high prevalence of these mosquitoes in North Carolina. Another map just to show you this is really what's heightened the awareness and kind of the announcement of this as an outbreak by the World Health Organization is how prevalent and how many cases are in our Americas and Southern Hemisphere. This map is showing where the cases are, where they've been identified in the United States. There are 107, so only 107 cases in the United States. 5 of those are in North Carolina. Of those cases, the 107 that are reported that have been travel-related, there have been no locally acquired vector-borne cases, meaning none of the cases in the United States are reported of being occurring here, mosquito bite to individual. What that means is people have either traveled and gotten bitten wherever they were traveled and come here, or we do have a few documented cases of being spread through sexual partners. So just to touch on the worldwide response, so back February 1st is when the World Health Organization declared this is a public health emergency of international concern. At that point, alerts began being provided to healthcare providers and the public about Zika to raise awareness. Travel notices began to be posted with travel-related guidance, specifically warning women that were pregnant or interested in becoming pregnant to limit their travel, and of course anyone traveling to try to protect themselves from mosquito bites. In the United States, back in January, on January 27th, President Obama called for the United States' response. Testing and vaccines and treatments were discussed. There is not a vaccine to prevent Zika, but testing in state laboratories was initiated. On January 28th, the FDA began issuing protective measures, and specifically the guidance at that point came out about deferring blood donations. Anyone that was interested in giving blood that had traveled to an area with Zika, they began deferring any of those donations for at least 28 days. And then back on February 2nd, which again really kind of increased the public's concern, was when the first case out of Texas came about this being able to be spread through sexual contact. And after that point is when additional guidance came out about then kind of reiterating safe sex practices and using condoms, and for women whose spouses may have traveled to an area where the Zika outbreak existed, extra guidance and precaution for them. The other thing that came out then that we started seeing in January is the guidance that any pregnant woman that had traveled to an area where Zika was prevalent, for them when they came back, whether they were symptomatic or not, to go ahead and get tested. And we have been doing those tests here, drawing the blood here and sending to the state lab. So we have had several women that have come in to our local health department to get tested. Back with the preparations, and this was the same kind of approach we did with Ebola, and you all can rest assured with any communicable disease that we would do. We start with our conference calls and our webinars with our state partners. The North Carolina Local Health Department Association, we actually had a call before even the CDC put out their call. So with all of the 100 counties represented on the call with our state folks to receive guidance on Zika and then to start getting it out to our providers. Ongoing, we have our EPI team stage. I know we've spoken about our local epidemiological team. We were certainly keeping them and continue to keep them briefed if we need to engage with any specific actions. We're ready to do that. I already mentioned that we've been doing testing here locally. And this being ready and staged goes beyond just our clinical staff. So our environmental health staff, led by Jack Fife, they've been involved in this. They've participated in webinars as well. This one, I do want to highlight the web address that's put down there, the darenc.com Zika. So we worked with our partners here. Dorothy, thank you. And Kelly has helped from our department get that website up. If anyone has any specific information that they want to learn more about Zika, you can type that web address in. It links directly to a lot of the information from the CDC, but it's linked to your web page and provides just a lot of information. This presentation will be up there later as well. So. And then really probably the biggest message and most important message, I think, with Zika is just the message of prevention. And this is the same thing as the message when you're trying to prevent any vector-borne disease associated with mosquitoes or with insects. So specifically, while traveling or either while here, using insect repellent that has DEET, stay in air conditioning, make sure your doors and windows are covered with screens, wear long-sleeve shirts when you're outside and long pants, and treat your clothes as well with the insecticide. If you are traveling and you return, as I mentioned, if you're a pregnant woman, you can get tested whether you're symptomatic or not. If you are not pregnant, though, and you return from an area that had the Zika outbreak, if you develop any symptoms of fever, joint or muscle pain, eye pain, you might hear conjunctivitis associated with it, or a rash, contact your doctor, or you can come to the health department and get tested. So again, just general mosquito prevention is really what we're stressing here. I mentioned already about protection, to limit any sexual transmission of this disease. Because it is noticeable that, they're still studying this because this is still kind of emerging, some of the science associated with this, but the understanding is that the Zika virus can remain in semen longer than it's detectable in blood, and so that's why with this outbreak of sexual transmission, they're trying to limit or prevent that. Specifically in Dare County, we have a very strong mosquito control program that's been in existence for years. The bottom of the slide here, I'll call out, and you can find this on Dare County's website, but the video that Edward Mann did, Bobby's featured in that as well, from a couple of years ago about the measures that our county does to prevent mosquito control. It's basically a four-pronged approach with source reduction, larviciding, adulticiding, and biological control. And that's explained very well in that video, so I encourage folks to look at that. It talks about what we as citizens can do with reducing standing water and protecting ourselves to help limit the spread and growth of mosquitoes. Again, the species that's primarily here is the Colex species, and the two biggest arboviruses of concern in Dare County historically have been the Eastern equine encephalitis and the West Nile virus, and those continue to be our biggest threats here. So with that, I will again highlight the darenc.com/Zika site, and then I'm available for any questions if you have those.
Thank you, Sheila. Very detailed report. I appreciate that. Commissioner Shea?
Because it takes a long time to develop a virus, a antidote or whatever you want to call it, is any company or government working in that area? And
Jack, I'm not sure if they are. I would certainly hope to think there were. We are not getting any information about that. All the information that we're getting at this point is just managing, if anyone does have symptoms, managing those symptoms. But we're not giving any indication at this point about anything that's emerging in any near future with respect to a vaccine or to treatment.
Right now, because it's limited in terms of problems in this country, it would probably be considered an orphan drug, and it's very expensive to develop a vaccine. I know because I've been involved with vaccines in the past. So
you have firsthand.
And I hope that some company or the government is working to try to develop a vaccine, because that's going to be the answer.
Absolutely. And you well know, the biggest threat of any communicable disease or how you measure that threat is by either the reproducivity, so the amount it can be reproduced and spread, or the mortality. And overall, especially where we are, both of those related to Zika are very low, very, very low.
Right.
And I guess, if you're looking at the emphasis of developing something like that.
It seems
Who
we
knows how they go.
get, in life, as the years go by, we get one terrible disease after another terrible disease after another. So
That's right.
anyway, thank you for what you do.
Thank you.
Thank you, Jack. Vice Chairman Owen.
Sheila, thank you for your report. We are currently kind of in early March, and the information that's come about has been a sort of a compilation of information from all of these areas that you have mentioned. Do you think it would be worthwhile to come back and give a follow-up on this, say in whatever you would suggest, but I would think in the warmer months when this may or may not, hopefully may not occur, kind of give us an update at that point in time, maybe June and August or whatever month you feel like are appropriate.
Sure, I would be happy to do that, and we get into the summer months and see what's happening. Hopefully, it'll be a really quick report and say not much has developed. But either way, I'd be prepared to do that.
Thank you.
Thank you, Vice Chairman. Anyone else?
Good report, thank you.
Thank you.
Commissioner Umflett, I know you had a concern, but I think she addressed that.
Yes, my real concern is I don't know about the other areas of Dare County, but I do know that on Roanoke Island we have ditches that have standing water that stand year-round. I don't know, in talking with different people in government, some of them might be state ditches, some of them might be on private property, others are just being neglected. So I don't know if that can be addressed. I know that it is a breeding ground for mosquitoes of all sorts.
Well, I do know as part of Dare County's mosquito control, they recognize that there are ditches that inherently have water and we're not able to remove all the water from. And in those areas, they do take and drop those pellets that then can eliminate those. My suggestion would be communicating if ensuring that the communication, I guess, probably with Edward Mann about any specific concerns, and then he can tell you whether they're on their regular treatment schedule or not. But
I was thinking more about drainage, because we have children living in those areas that are small properties, and the children don't have very many places to play. And I was thinking about the other contaminations that might be there.
Do these particular mosquitoes die from the same things that the other mosquitoes that we do normally as a treatment publicly as a county or as a private, the mosquito squads and folks like that do?
correct.
So they got the same thing that kills our regular mosquitoes kills these as well. Okay.
And one thing, and we'll continue to learn more, you may have heard about the announcement last week. The North Carolina medical director announced hiring 2 entomologists. So unfortunately, through cuts in previous budgets before, those positions were eliminated, but he was able to get funding to hire 2 of those to then come out and study across North Carolina areas tracking these mosquitoes and the specific species and whatnot. So I think we'll get more information on that. But I think the focus is really tracking where they are and where the high prevalence, and then if the state needs to provide any additional support for that.
Commissioner Shea?
I got another comment. You know, vaccine, as I mentioned before, that's kind of a negative approach, but it's all we have now. But I wonder if any company or the government is looking into the possibility of raising male mosquitoes, radiating them to sterilize them, and then release them into the wild, so that when they mate with females, the result is nothing. Nothing is born. So I think that is, in my opinion, would be a more positive way to approach it, from a 2-pronged vaccine plus releasing sterilized males into the wild. So.
That's a great strategy. Yeah.
Anyone else?
Mr. Chairman, I have one comment.
Yes, sir.
I think this becomes more and more important that we do some preventive work on mosquitoes, period. I think that you were hitting it right. The seeding program is something that's proved very helpful and something that works very well. But we might need to do it more and more because, like anything else, it has a time limit on it. and we have to be able to do more of the work, especially as she's talked about Roanoke Island, Hatteras Island, Soundside on the beach roads, all those in the mainland, of course, all have huge problems with drainage and water standing and that type of stuff, which breeds mosquitoes. And it looks to me like it would be a whole lot and more beneficial and a lot cheaper to do a lot of seeding than it would be to do aerial sprays and stuff later and be caught in it. If we can kill the larva before it gets going, we can stop an awful lot of the diseases that are carried by mosquitoes, period, whether it's this or epicus or any of the other stuff that's involved, because there's a number of things that have already there that have been deadly to people in Dare County already through mosquitoes. So it might be a good time to really look at that whole program and see if we can't do some more prevention work there, Mr. Chairman. Board, thank you.
Mr. Chairman,
Yes,
I
ma'am.
have one question.
Yes, ma'am.
Dr. Davies, will the health department be offering testing for the virus?
Yes, we do.
Okay, great. Do they need an appointment?
It's best to get an appointment. That way you're not, sitting. If you have an appointment, we can get you in and get you out quickly. So,
All right, thank you.
certainly.
Okay, thank you, Sheila. Anyone else?
Thank you.
Thank you very much.
Thank you very much, Sheila.